Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Concussions. Introduction. A concussion is a mild injury to the brain. It is usually caused by a blow to the head or a sudden violent movement of the head. Every year, about 300,000 concussions are reported among football players alone. Many others are unreported. Most people recover from concussions, but a brain injury that looks like it's mild may hide a severe brain injury. Severe brain injuries can be fatal if not treated. This program explains concussions. It talks about the symptoms, causes, and types of concussions. It also explains how concussions are treated and provides tips for athletes. The brain and TBI. The brain is the control center of the body. It controls movements, actions, thoughts, and sensations. This section explains some of the parts of the brain and how they may be affected after a traumatic brain injury, or TBI. Fortunately, most concussions do not have the complications discussed in this section. The brain has the consistency of gelatin. It floats inside the skull in a special fluid called cerebrospinal fluid, also known as spinal fluid or CSF. This fluid acts as a shock absorber, protecting the brain from blows to the skull. In accidents where the head is suddenly and violently shaken, the brain may push the cerebrospinal fluid and hit the skull. Even if the brain does not hit the skull, the sudden acceleration and deceleration of the brain can cause injury. This may cause bruising and swelling known as contusion. When injured brain tissue swells up, it puts pressure on the rest of the brain. The hard and rigid skull does not expand. This makes brain swelling more dangerous. It causes more pressure on the brain itself, which results in more damage to the brain cells. Usually, brain swelling starts at the time of the injury and is worse 3 days later before it starts going back to its normal condition. If the swelling and pressure is severe and is not treated, it can lead to death. Brain cells need oxygen and nutrients to survive. These are delivered by blood vessels. The blood vessels of the brain could get hurt easily during a head injury. During a head injury, they can burst. This causes bleeding in or around the brain. This bleeding is also known as a hematoma. Bleeding, swelling, and pressure inside the brain can also cause less blood to flow to the brain. This can cause problems with how well oxygen, blood, sugar, and certain minerals are delivered to the brain cells. If the balance is not kept, too little or too much of different substances can become toxic to the brain cells, causing their death. Brain tissue is made up of small cells called neurons. Neurons have long fibers called axons. Axons can only be seen with microscopes. Axons work a lot like cables. They transfer information between brain cells. A sudden and violent trauma to the head can cause injury to the axons. This type of tearing is known as diffuse axonal injury, or DAI. This microscopic injury of axons can lead to long-lasting mental problems, coma, and possibly death. The brain has two parts, the left and the right hemispheres. Each hemisphere has specialized areas for movement, thinking, sensations, and feelings. Which functions are affected depends on which area of the brain is damaged. For example, if a hematoma injures the area of the brain that controls vision, the person may not be able to register and understand what they are seeing, even if the eyes are working perfectly. The brain is a very complex organ, and scientists do not fully understand how the brain thinks, feels emotions, and coordinates body functions. Because an uncontrolled increase in the pressure of the brain can injure different areas inside the brain, it is not always possible for healthcare providers to tell what will happen with a brain injury. The effects could be long-term mental, physical, emotional, and psychological problems. Causes. Concussions result from a sudden blow to the head or sudden acceleration and deceleration of the brain. Common causes of concussions include contact sports, vehicle and biking accidents, and falls at home. Falling at home is the most common cause of brain injury for toddlers and people over the age of 70. People older than 75 have the highest rate of hospitalization and death resulting from brain injury. Types of TBI. Healthcare providers view mild, moderate, and severe brain injuries differently. Concussions are considered mild brain injuries. Many concussions do not result in a loss of consciousness. Healthcare providers grade concussions to help treat them. The type and grade of a concussion depends on 1. If a person has or has not had a loss of consciousness. 2. How long a person had a loss of consciousness. 3. How long memory loss after the injury or post-traumatic amnesia lasts. 4. How long the symptoms of confusion, headache, and dizziness last. Patients suffering a grade 1 concussion have not lost consciousness and have no loss of memory after the trauma or loss of memory for up to half an hour. This type of memory loss is called post-traumatic amnesia and is the loss of memory of what happened for a period of time after the incident. For example, a football player who has suffered a grade 1 concussion during which he has not lost consciousness may not be able to remember the incident and what happened for up to a half an hour after the injury. Patients with a grade 2 concussion lose consciousness for less than 5 minutes or have post-traumatic amnesia that lasts between 30 minutes and 24 hours. Patients with grade 3 concussions lose consciousness for more than 5 minutes or have post-traumatic amnesia that lasts for more than 24 hours. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Symptoms. After a concussion, the person may or may not lose consciousness. If consciousness is lost, it lasts from a few seconds to minutes. The person may be dazed and confused. It is normal for someone who had a concussion not to remember the events right before, during, and right after the accident. Signs of confusion include a person not being able to think and communicate clearly, a person not being able to remember where he or she is, a person not being able to do a sequence of goal-directed movements when asked. For example, a patient may not be able to follow commands such as touch your left ear with your right hand. A person shows perseveration, which is when patients repeatedly either ask the same question or say the same thing over and over. Paramedics and sport trainers who suspect a concussion may ask the injured person what year it is, who the president is, or ask them to count backwards from 10 to try and find any changed brain function. Other symptoms of a concussion include headache, lightheadedness, dizziness, blurred vision or tired eyes. Other symptoms of a concussion include bad taste in the mouth, fatigue, sleep disturbances. The injured person may have trouble with memory, concentration, attention, or thinking. If a person has a more severe brain injury than a mild concussion, he or she may have the same symptoms as those of a concussion, but with more severity. Other symptoms of severe brain injury include repeated vomiting or nausea, convulsions or seizures, expansion of one or both pupils, slurred speech, weakness or numbness in the extremities. A person with a more severe brain injury may also have trouble waking up from sleep. When to see a healthcare provider. If you or your loved one had a concussion, you should always get checked by a healthcare provider if the signs include a headache that lasts more than an hour or two, vision problems, dizziness, nausea or vomiting, difficulty with balance. You should also see a healthcare provider if you experience confusion, memory loss, ringing in the ears, difficulty concentrating. You should seek emergency medical care if your symptoms or those of your loved ones include convulsions, which are involuntary muscle contractions, and rigidity, usually along with a loss of consciousness, not being able to hear, taste, or see, difficulty understanding information, weakness or numbness in the hands or legs, slurred speech or difficulty finding the right word, repeated vomiting. It is important to realize that rarely a patient with a head injury may seem totally fine and have no symptoms for a few hours while a blood clot forms on top of the brain. As the clot gets bigger, symptoms start to show up. It is important to check on the patient every hour or two. As you check with the patient, ask them questions to make sure they know where they are. Ask them to move their arms and legs to make sure there is no early weakness. Check their pupils to make sure that they are not becoming unequal in size, with one becoming much bigger. If the patient has done fine over 12 hours, then they do not need to be checked anymore. Minor head injury, especially in older people, can lead to a different type of bleeding, a bleeding that may not show up on a CT scan done immediately after the injury. This type of bleeding is known as a subdural hematoma. Symptoms usually show up weeks later in the form of headaches, weakness, loss of balance, and speech problems. It is important to be on the lookout for such symptoms right away after a head injury. Complications. People who suffer a head injury may suffer from side effects that continue to happen for weeks or months. This is known as post-concussive syndrome. Post-concussive symptoms include memory and concentration problems, mood swings, personality changes, headache. Other post-concussive symptoms include fatigue, dizziness, insomnia, excessive drowsiness. If the brain injury is severe, it can lead to serious complications such as bleeding, blood clot, and cell death resulting from decreased blood flow to the brain. If not treated, these complications could lead to more damage to the brain and even death. If a person has another concussion before recovering from the previous one, the second concussion is much more likely to be severe. This is known as second impact syndrome, which can be fatal. This is why athletes who have suffered a concussion, even a mild one, may be asked not to play for the rest of the season to avoid a much more dangerous second concussion. Some complications respond well to treatment, but the brain may take a long time to fix the damage or may never be able to fully recover. Some of these long-term effects include cognitive disabilities, personality changes, sensory problems. Other long-term effects include headaches, seizures, post-traumatic stress disorder. Diagnosis. Your healthcare provider will perform a physical and neurological exam. He or she may ask you to perform simple tasks and answer questions. This will help your healthcare provider see if there has been damage to the brain. Whether the concussion looks severe or mild, the healthcare provider usually needs to assess the situation quickly to treat complications, if any exist. Often, healthcare providers rely on images of the inside of the brain, called CT scans. CT scans of the brain may be done to make sure that there are no fractures in the skull and no blood clots or bruising in or around the brain. Depending on the patient's condition and the first CT scan, the patient may need to stay at the hospital and be watched closely. If the injury is severe and needs surgical treatment, the patient may go to surgery right away. Most concussions are mild brain injuries that do not appear on the CT scan. The healthcare provider will then rely on the symptoms of the patient to figure out the grade of the concussion. Treatment. The standard treatment for a concussion is rest. If you have a headache, you can usually take some over-the-counter painkillers like acetaminophen. Ask your healthcare provider which medication is best for you. If the healthcare provider requests a CT scan and the test shows bleeding or severe injury, the brain injury may require hospitalization, close monitoring, and treatment. If there is a fracture or a big blood clot, surgery may be needed to fix the skull and take the blood clot out. For athletes, Patients with post-concussive syndrome should avoid activities that put them at risk for repeated concussions. Athletes should not return to play while experiencing these symptoms. Depending on the severity of the concussion, an athlete may return to play the same season. It is very common that an athlete may sit out the rest of the season to avoid a second concussion. Athletes who get repeated concussions should consider ending participation in the sport. Athletes should wear the appropriate sports safety gear, such as helmets or headgear, at all times. People who bike or skateboard should avoid uneven or unpaved surfaces, obey all traffic signs, and be aware of drivers. Repeated concussions can lead to significant problems. Some of the symptoms may not show up for years. These include memory problems or dementia, forgetfulness, tremors, or the inability to walk or to use the arms and legs. This is a big problem for boxers.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A concussion is an injury to the brain that is usually caused by a blow to the head. It results in temporary loss of normal brain functions, such as consciousness, awareness, and thinking. People with concussions often cannot remember what happened right before or after the injury, and they may act confused. A concussion can affect memory, judgment, reflexes, speech, balance, and muscle coordination. Some concussions are mild and some are more severe. Most people recover from their concussion, and a single concussion does not usually cause permanent damage. But a second concussion soon after the first one can have serious complications, which can be disabling and even deadly. If you or your loved one had a concussion, you should always get checked by a healthcare provider if the signs include a headache that lasts an hour or two, vision problems, dizziness, nausea or vomiting, difficulty with balance. You should also see a healthcare provider if you experience confusion, memory loss, ringing in the ears, difficulty concentrating. You should seek emergency medical care if your symptoms or those of your loved ones include convulsions, not able to hear, taste, or see, difficulty understanding information. You should also seek emergency care if you experience weakness or numbness in the hands or legs, slurred speech or difficulty finding the right word, repeated vomiting. Thank you for using Explain.